Okay. Well, how it started was the fact that this is about 5 years back now. We, at one stage, will encounter a lot of delays in our appointment, in the sense that there were about 2 weeks waiting time to get for someone to come in, and also the fact that I find that my staff are constantly on the phone trying to find us or giving patient results and trying to make appointment. And with the help of wireless and Karada, we developed this SMS thing. So as a result of that, we've been able to actually, deal with 90% of our test result through this service, which means that we're looking at about 9,000 results a year that can be, instantly resolved. And what's more important is that it's sent to SMS. The patient would have a record of the result, plus the fact that it will also in our clinic management system, there will be a record of that, and whatever response that the patient sent back will be kept within their case history. When we actually look at the patient that come in, the age distribution of people coming down this clinic, in fact, majority of fit into the age group that also the most familiar and ownership of mobile phone and SMS. That's how we thought that that's a good way of doing that. One prime example would have been in the sense that I have a patient that, because our young people are traveling a lot now, and they want to find a result. He actually rang from Japan to find a result, and we were able to just, SMS him, and as long as he has global roaming, he can get his result anywhere, anytime they like. Previously, before this service came along, because some of the positive results which are under Notifiable Disease Act, we need to make sure that actually the person need to get it, and we need to send certified mail to them, and so on and so forth, and all that need to be documented. And as a result, well, we don't have to do that now. It's all sort of documented now. So.
And the Queensland Health basically accepts the secure SMS response from the patient as basically a duty of care in terms of delivery.
Because we've already shown that that's sort of encrypted when they send back whatever. It's all documented within the case note, so it is a legal document. Initially, a lot of people actually don't trust how secure this is, and so in fact they usually ask us to put them on the secure SMS thing. But after a while, they tend to, they begin to trust us, and they now just use the standard SMS. So it's pretty useful for a group of people, particularly for us sending some sensitive result.
You also mentioned that you send 9,000 negative tests back, so the patient has that test okay.
Yeah.
How much time does that save you in terms of productivity?
Well, huge, because it takes me less than 30 seconds to send that SMS saying that all your results are normal. For example, we need to do a repeat test in 3 months' time. We'll see you in such and such a time date. So that's all done on the on our desktop computer and sent out. So that's done in no time at all. And also we can add whatever message we want. For example, if someone's done well, for example, some of the HIV patients, their immune function has improved, we would say, well, congratulations, your cell has improved from such and such, well done, and you should continue making sure you take the medication every day. We also use the SMS to remind patients when they start a new treatment, what time, when to take it. We can now send them reminders to take time for them to take. And those are the people that it's helpful to those people who's just starting a lifelong medication program in the first month or so. They need a lot of support and reminding. So, and that's been quite helpful as well.
Okay. Thank you, John.